So everyone is taking apple cider vinegar and everyone's talking about it. Everyone's talking that apple cider vinegar cures a lot of things, that it cures parasites, that it cures diabetes, it cures polycystic ovarian syndrome, that it really magic? Is it really something that it could be useful? Or is it something that you should be aware of? And you should be avoiding apple cider vinegar at all costs because it's very dangerous. Nutritionists, a lot of people saying that it's very dangerous if you consume apple cider vinegar. So in this video, I want to talk about apple cider vinegar. Which are the uses? Which are the benefits? What's inside apple cider vinegar that makes it so special? What are the risks? What are the real benefits from consuming it, and which are those conditions where it really works, and which are the precautions that you should be taking? So let's get started. Apple cider vinegar has gained a lot of attention recently, and a lot of people are looking for apple cider vinegar and its benefits. And when we go and dig inside apple cider vinegar, what are we going to find? What are the nutrients that are interesting about apple cider vinegar? So we can talk mostly about one, and it's the content of something called acetic acid. Acetic acid is the most important nutrient. Although apple cider vinegar, you're going to find different amounts of some vitamins, you're going to find different amounts of minerals inside of apple cider vinegar, and of course they're important. The amount of nutrients, of other nutrients different from the acid of what you're getting in apple cider vinegar, it's very low. So you're not going to be taking apple cider vinegar because of its iron content or for its vitamin C content or any other content. You're taking apple cider vinegar because of the content of acetic acid. Why is acetic acid so interesting? Well, we could group it into two different groups. Group number one is going to be everything related with inflammation, related with glucose control. Of course, this is not a thing minor. This is something very important because everything related with glucose control is going to be related with gaining weight, being obese, having pre-diabetes, diabetes, polycystic ovarian syndrome, everything related with cardiovascular disease, which is the #1 cause of death in the world. So of course, it's going to be helpful, and I'm going to tell you why in a minute, and I'm going to tell you which is the best way to consume it for your health. Number two is everything related with your GI function, with your intestine, with your stomach. Why? Because we need to remember that our stomach is acidic. If you go and type on Google, what is the normal pH of the stomach, you're going to find that the normal pH is between 1 and 3. Or between 1 and 2. So in between 1 and 6, what gets closer to 1, it's more acidic. We lose the amount of acid in our stomach because of very different reasons. We lose it because of our diet, we lose it because of stress, we lose it because we don't sleep well, and we lose it also as we age. When we have a bad stomach, it doesn't work well, we have a bad digestion, we don't absorb or we don't assimilate as we should, a lot of different things, and we're going to have a bunch of different problems. So when we ingest apple cider vinegar, which are the mechanisms? So the acid helps in the metabolic process. It helps so the glucose spike, it's lower in altitude and it's lower on time. Most of the time it's more important when we control the time in which that glucose spike it's present in your blood. So we need to have that in mind because this is mostly one of the things that are most important in order when we want to control everything related with insulin resistance. So this is going to be very helpful, although it's not going to be the only thing that I should be doing in my lifestyle in order to control everything else. And it's something to be magical in order to get cured from diabetes or pre-diabetes or being overweighted, to lose fat, to lose weight. No, of course not. It has to be done as a part of something else and as a part of all the other things that you're doing in your diet. The other side, when I consume apple cider vinegar, it gets into my stomach. And my stomach, if it was losing its capacity of being acidic, it's going to recover that capacity. It's going to get more acidic. It's going to have a pH closer to the regular and natural pH that I should have. So in that way, I'm not going to have heartburn, I'm not going to have reflux, I'm not going to have a premature emptying of the stomach, I'm not going to have gas because of the malabsorption of nutrients that I'm having because I don't absorb protein, because I don't break protein that it's necessary with the acid in the stomach. So in this way, it's very, very useful. In my practice as a physician, I've seen more than 8,000 patients in my practice over the years, and I've treated a lot of people. And when you go and check for evidence, for papers, you're going to find papers for the first part that I told you. You're not going to find papers for the second part. But if you go and check on a physiology book, what's the normal pH of the stomach? If you go and check on YouTube, on Google, if you go and check on ChatGPT, what's the normal pH? And you know that there are things that make your pH increase, so you have a pH within 4 or 5, which is not the normal pH, your stomach is not going to work well. You don't need a paper to remember that if you want your stomach to work well, you need to recover its natural function. It wasn't always like this. There was a time when I thought that you need to give antacids to patients in order to not have symptoms. But giving an antacid is putting my stomach far from its regular function. Can everyone consume apple cider vinegar? The short answer is yes, and also the short answer is no. Who needs to be aware and not consume apple cider vinegar? If you have any ulcer on your mouth, or if you have an irritation, or if you had a previous surgery on your mouth, if you have an ulcer, or you have bleeding in your esophagus, if you have an ulcer, or if you have bleeding in your stomach, if you have an ulcer or you're bleeding in the first part of your small intestine called the duodenum, you need to control that. Then you need to give an antacid so the acid doesn't burn that wound that you have. Once you get control of the inflammation, once it's not bleeding, once the ulcer it's already recovered, then you can start recovering the function, the normal function of the stomach, and that depends on a very wide variety of different factors. But one of them, for sure, it's recovering the amount of acid that you produce in order to have a good function for all of the other things that are necessary in the stomach. Different from that, everyone can take apple cider vinegar. Mostly everyone, yeah. Kids, adults, younger adults, older adults, mostly everyone, as long as they don't have any indication by its physician that they shouldn't be consuming it, everyone can consume apple cider vinegar. Which is the best way to consume it? Well, the best way is in 2 ways. People sometimes they come to me and say, "Oh, doc, I've seen your videos and I'm taking apple cider vinegar fasting first thing in the morning. I take a little cup and I drink it all." Who told you that? No, you don't need to be taking it just one sip on an empty stomach, fasting and just without water. No, you need to take it throughout the day, diluted in water. You can mix it also with a little bit of lemon if you don't like the taste. When you consume it and it's diluted in a little bit of water, then there's no risk of irritation in any part of your GI tract. If you don't like it at the beginning, you can start by a little dose, then you can go increasing. Increasing until when? Until what? Maybe 2 or 3 taps or tablespoon or teaspoons a day diluted in water. It's fine. Some people like to take it before meals. Before meals, it's fine. But for me, it's easier when you take a little container, you put water, maybe 2 liters, and you just put the water and you start taking it. In that way, your stomach is going to be prepared all the time. You can increase that consumption before the meal. Also, when you start eating, you can also take it in your salad. Remember that for controlling glucose spikes, the best thing is to start with your salad, with your vegetables. And when you put the apple cider vinegar in your salad, that is going to blend with the salad. You're going to chew that, and it's going to be beneficial for the absorption of carbohydrates, and it's going to help for the glucose spike. I don't encourage you to take gummies. because the matrix in which gummies are made is very basic, is very alkaline. Don't take apple cider vinegar gummies. Apple cider vinegar gummies are just gummies. Again, you can start taking it, start seeing how you feel. And once you do it, please remember to come back to the video and please remember to leave your comments so more people can start understanding why apple cider vinegar can be so beneficial for your metabolism, inflammation, cardiovascular disease, and also for your GI tract. And before you leave, please remember to share the video with your contacts. It really helps us so more people can start finding this content. Please remember also to hit the like button, subscribe to the channel here in the red button, and to click the bell. Every time you click the bell, when we make new videos, you are going to be the first person to get notified. So thank you guys, and until next time.